I'm Dr. Nicole Vane of Moonlight Beach Dental, and one of our top topics we get is laser root canals. People are always researching us because not many people have this laser, the Photonal Light Walker. And what it does is it pulses the inside of your tooth without using a drill, and it literally sends shock waves of energy down through the bottom of the tooth and back up to shake out all the bad, toxic bacteria or sometimes yucky infection that's been hiding inside of the tooth. So when a tooth dies, it allows all the bacteria to seep into the dentinal tubules. And what those are like thousands of stacked drinking straws. So when we do a root canal, traditionally, we just ream the inside of the tooth out with a little file. We soak the tooth in bleach and we seal it all up. And a lot of the sealers we use and filling materials have barium and other heavy metals in them that most patients don't want and they're not even aware are being put inside of their tooth. So what we do differently is we work with 3D technology to understand the anatomy of the tooth, which is really complicated. As 3D imaging has evolved, we see that teeth are much more complex than we ever realized on our standard films. So we use the laser after opening the tooth to flush the tooth out with ozone water and other medicaments. And the laser energy will shake out all of that stuff out of the dentinal tubules and allow it to be cleaned out of the tooth before we seal it. Then we use ozone gas in addition to ozone water, which further oxidizes and puts an oxygen bomb inside of the tooth to get any of those hidden microbes that are like anaerobic to begin with. So it kills everything inside of the tooth. Again, in a painless way. And before we seal the tooth, we use a bioceramic sealer, which is actually biocompatible as our filling material. So those are the things that make us different. And at the end, especially if someone has a hot tooth, which are the traditionally most painful teeth, we use our laser therapy on low-level light therapy to help break up that inflammatory cycle. So people, even if they come in swollen or really hurting, can leave without pain. And it's really incredible to see how root canals can be done differently after having been in this industry for 20 years. If you'd like to know more, feel free to ask questions here at Moonlight Beach Dental.